Thank you guys so much for joining. My name is Sierra. I'm the CEO and founder of Elite Precision Consulting. Welcome to Global Healthcare Summit 3.0. As the owner of Elite Precision Consulting, we focus on global facilitation, meaning how you can work with teams around the world to accomplish your goals, your missions. And we wanted to have this summit to further highlight the great companies and talents in different countries around the world. Some of these countries we have done business in pretty extensively. Others, it's new to us. And we also wanted to learn more about what's happening in their region, what opportunities are there, also how they can enhance their global collaboration, what partners are they needing to bring on board to further their mission, and maybe you as an attendee, maybe you have that solution. And so we're here to talk healthcare related topics. Although our company handles multiple sectors, we really love healthcare. We've been in healthcare for 17 years and just wanted to further amplify that. I'm going to introduce our next speaker if he's ready. I believe so, Dr. Poku. We've talked a lot about healthcare and technology and all the things that are happening in our region. Dr. Poku is coming from Westview Medical Centre and all the great work that he's doing in Ghana, Africa. And I'm just very excited to introduce him. Great man, great leaders, great innovator. I love his mind. I love how he thinks. And I'm just very excited to hear what he has to share about what the healthcare system is looking like in Ghana and how they're making an impact.
Thank you, Sierra. Good morning. Can you hear me? That's good. So my name is Dr. Gideon Poku, and I'm from Ghana, Africa, and I'm speaking from the western region of Ghana, Takoradi to be specific. I don't have any presentation to share, so I'll try to make this as interactive as possible. So I am a medical doctor, I'm a medical officer, and I work at Westview Medical Centre, which is a private facility. I also practice as a medical officer for the obstetrics and gynecology department of Ifeanyi Regional Hospital. So basically, I'm excited about this summit, because at Westview Medical Centre, which is the private facility, we're basically focusing on providing medical care, holistic medical care to the sub-region that we live in. Ghana being an African country, obviously, especially right now, we're having a lot of economic struggles. The government is struggling, people are struggling. So a lot of the times, most of our interventions that we try to have in place is to make sure that healthcare is affordable for the whole population, which is good. It is great. We have the National Health Insurance Scheme, where people can pay as low as about 15 cedis a month, which is actually less than $10 a month, and they can get healthcare without paying anything. It is good for the general population, but the downside of that is that because it's so cheap, then the health insurance scheme is not able to reimburse the health facilities for them to be able to procure medical supplies and medications and all of that. So it makes our general healthcare system, the public healthcare system, not very robust. And it leaves gaps for people who can actually afford healthcare. So at Westview Medical Centre, which is the private facility, what we are trying to do is we are trying to make sure that we can have a facility that would be able to provide the healthcare for people who can actually afford it. And we've been in practice for about 5 years now. Ending of last year, by the last quarter, we saw our patient load increase every month from about 500 patients. Last month, December, was our best month yet. We almost had 1,000 patients. So it tells you that people are really understanding what we are about. People are understanding the practice that we're practicing and also the service that we are giving. Our main aim ultimately is to expand, and we have plans in place so that in the next couple of years, when we are able to have every department working, we have various specialists. I mean, even till now, we're able to have various specialists come in whenever we need them to provide service for people in the Western region. But we want to expand to get to a place where we can have clients come in and maybe pay for their medical care and then pay a percentage that would go into charity. So say they come in and their healthcare costs $100, then they can opt in to pay $120, knowing that that $20 will go in for someone else who can have to afford healthcare, particularly the one that we are given, because usually that is very hard to find in the public hospitals. Currently, we run general OPD services. We run specialist obstetrics and gynecology, general surgery, orthopedic surgery, and all of that. We are also very interested in medical tourism. Right now, I have about 3 patients who need kidney transplants. They can afford it, but it's very difficult to get a kidney transplantation services in Ghana. So what we're trying to do is right now to liaise with hospitals in India and Turkey to see if we can fly them over and get kidney transplants. There are so many challenges that we are facing right now in our sub-region in Ghana. Kidney transplantation is one of them. We have problems with taking care of people with cancer. We also, even in emergency situations, we have a lot of the public hospitals and even the private hospitals that lack the resources to take care of patients who need critical care. So these are all the things that we are trying to do. We're trying to bridge that gap so that if we can have global correspondence and global partnerships, then we can have colleagues from other parts of the world. They can come in, train the staff, train the human resource here, so that we can manage certain conditions that are usually not managed, in Ghana and in Africa. If it's also possible, then we can also liaise with them, partner with them, so that if we have patients who need certain care that we cannot give in our sub-region, then we can have them go over to their countries, maybe Indonesia or the Philippines, or Bangladesh, if they have the
Dr. Poku, did we lose you? I think we may have lost him. We'll just wait for him to join here in just a moment. Wow, just great topics. What he was just speaking about are some of the challenges of getting the right care. He was talking about kidney transplants that's needed, and trying to get those kidneys in Ghana, how hard it is. And this is exactly why this kind of platform is so important, because having these kinds of problems in one part of the region, there's obviously solutions that can be found, and maybe that is outside of the country. So I'm happy that he was speaking about that and some of the needs that he has with specifically the kidney patients and kidney failure, and being able to bring that in from outside. All right, Dr. Poku, I think you're back. Yeah, go ahead.
I'm very sorry about that.
Oh, no, it's fine. It was good. Go ahead.
Yes. So, we have problems with patients with cancer, and having the medications for them. The whole healthcare in Ghana is so centered around prevention of communicable diseases and infectious diseases. And because most of these conditions are mainly afflicted, by the people in Africa, it is very less funded globally. So then we neglect other medical conditions, like cancers and, even diabetes and hypertension. So what we are trying to do basically is to make sure that for the people who can actually afford it, then we give them that health care. There's also a lot of opportunity, particularly where I live in Western region, where we have a lot of natural resources. And so we have a lot of companies. We have oil and gas companies, we have mining companies, and we have a lot of, rubber making companies. where they come in and they're producing all these things, but then getting access to healthcare for their staff becomes a problem because most of the time the sites for these companies are in remote places where they don't have, clinics and hospitals and healthcare centers. So there are a lot of opportunities to expand services so that you can have an on-site clinic for some of these companies where you can take care of their clients and their staff, so that if they need be, then maybe sometimes you can refer them to your main facility. So we are also working on that as well. One of the things we are realizing these days with taking care of clients here is that there are lots of people that neglect their health care, particularly in the corporate industry. You have people who work for companies that overwork them, so to speak, or that's what they will tell you. And because of that, their health care is neglected. We have a lot of 30-year-olds, 30-something-year-olds, 20-year-olds that we are seeing with hypertension and diabetes. And it's basically because they work and then they forget to take care of themselves. So there's also a huge opportunity in occupational health and making sure that you see companies and you give them the needed education and the needed healthcare, or even take it to them and make sure that you're reviewing them for having all these chronic medical conditions. Even though as a healthcare company, we are making sure that we are delivering quality healthcare to people who can afford it, we are also very cognizant of the fact that there are also people who would need our care but cannot afford. So currently we've adopted a children's home, like an orphanage that we take care of, the children for free. But then again, we want to expand that even beyond just a children's home. Maybe we want to have a program where people can apply and then we can certify that they are paupers, so to speak, and so that they can come and also enjoy the healthcare service that we give. But it's still in discussion, but we want to look at maybe letting some of our clients who can actually afford pay a percentage of their fees per healthcare, and we will use that to take care of such clients. So that's just a brief introduction of what we are about. I don't know if there are any more questions that you would want to have, or any of our audience have.
Yes. Yep. So some questions that were asked, because maybe this kind of stems from the topic earlier today and yesterday. One of the questions is dealing with digitalization. So we've been talking about this a lot. Every country has kind of been speaking a little bit on how they're using technology, if it's being accepted, if it's not being accepted. So in your area, what is kind of the tone of the patients when it comes to digitizing or accessing their medical records in a digital platform? Can you speak to that a little bit?
Yes. So generally, again, I live in the western region of Ghana. It's close to the capital, but there's still a lot of development that it needs to go through. When it comes to the government hospital or the public hospital where I work at as well, technology is not very well accepted. People are still used to the older system of hospital, walking into the hospital at any time that they prefer without knowing whether a doctor is going to be present or a nurse is going to be present, So it's not very well accepted in that regard. However, there's also a whole other side of the spectrum where if you come to the private facilities where you have more people from the working, environment coming in, then they prefer to have, prior booking, before they come in for services. Sometimes you see them and they want to have access to their lab investigations, their imaging investigations that are done, and there are a lot of progress that is going right now, and the adaptation for that is great. There's a lot more that can be done. Currently, my health facility, we do not have X-ray and CT scan services, but we have a sister company that we refer our clients to get X-rays and CT scans and MRIs done. And we've been able to liaise with them and connect their system to our EHR, so that anytime we refer a patient there and they see that the patient is from our private facility, then they're able to send us the reports, and we get it even before the patient comes, and we review that. Of course, Sierra, we were also in talks earlier on last year about how we can, incorporate some like a booking services on our website, and patients can talk to doctors directly. They can send us messages, and we can get it on our cell phones and all that, which I think it will be great to have. Sometimes when we have clients come in, or when we go to some of these corporate institutions, these are some of the things that we tell them about, and you can tell that they're very excited about it. Usually they are working very long hours. Ghanaians are actually very proud people. So a lot of them don't like to even accept that they are sick. So if you have a system where it's easier for them to come to the hospital, it's easier for them to book at their own convenience and come to the hospital. And also if they have access to their medical notes and their lab investigations and all that, they can have more insight as to the medical conditions that they have. The progress that they are making, how their treatment is going. They will feel more involved in their healthcare, and it will encourage them to patronize healthcare more.